For chronic neck pain, the treatments out there really just don't work. They're primarily stretching, which most of the time it doesn't need to be stretched. These muscles actually need to contract. They're very gentle, strengthening isometric or barely lifting your head up off the table. And again, there's just not enough resistance and there's not enough movement in range to actually have a lasting effect. Then you have your modalities where it's your taping, your massage, your trigger point, your ultrasound, your heat, your TENS unit. And this just really makes you feel better in the moment, which feels nice, but it has no lasting benefits. And then you have your injections and your medication, which are more of the same of just masking your symptoms. And that is the majority of the treatments out there for a lot of conditions. And that's why a lot of people are left with chronic pain. And a lot of people out there have chronic neck pain and they're not getting the results, the relief that they want. And eventually they're either saying there's nothing else to do, there's nothing else out there, or they give in and they end up getting surgery and now they're left worse. They're left with a fusion that might need another fusion in a few years. They're still having their symptoms and now they don't know what to do and they're just relying on medication. And that's why I built my neck course. What I see in my clinic as an expert orthopedic physical therapist with 17 years experience and 4 advanced certifications in the orthopedic world is that even for patients with chronic neck pain, I expect around 50% improvement or more in about 4 weeks. And why? It's because my approach is simple and logical. You need mobility and then you need strength in that range. So we work on getting your spine mobile in all the areas that you typically need it, including your upper thoracic spine, which is primarily missed in most treatments. And then we work on contracting the muscles in that range. And in 4 weeks, I expect to see significant results. So if you're out there, if you've seen what I've seen, that these treatments make you feel good, but it's temporary, or they're really just not effective, then I agree with you, and there is something else, something before surgery, something that is better than injections and medications. It's just getting your spine moving and getting your muscles strong in those ranges. Simple, logical, but effective. And if you want this approach, thespinaltruth.com, look for my neck course. You can do it from the comfort of your own home, at your own pace. If you stick with it, you will see results.